Hey guys, Dr. St. Jean here at The Chicago Chiropractor. In this video, we're going to talk about how you can tell whether or not the headache you're experiencing is a migraine without aura and what to do about it. So keep watching. If you're suffering from headaches that are lasting a really long time in terms of duration, and maybe they're reoccurring, there is a good chance that it would be considered migraine without aura headache. But also keep in mind, there's many different types of migraines. However, migraine without aura happens to be the most common type of migraine. It's crucial that you come in for an actual comprehensive exam because migraine headaches can often be accompanied with other headaches such as tension headaches or medication-induced headaches or different types of migraine headaches. So it really kind of muddies the diagnostic waters. Figuring out what is actually causing your head pain is the starting point for getting you better. So how can you tell if the headache you're experiencing right now is migraine without aura? Let's take a look at the signs and symptoms associated with this headache. Typically, this headache will progress through 3 phases of symptoms. Now, keep in mind, just because we know that classically it should present with 3 phases doesn't mean that everyone will present with those 3 phases. It's not always so clean cut. But those 3 phases of symptoms are prodrome, then the actual headache, and then postdrome. The first phase usually presents before the actual headache, hence the name prodrome. And typically this occurs hours to days before the actual onset of headache. The symptoms that occur during the prodrome or first phase of migraine without aura headaches vary from person to person, but they can be things like constipation, diarrhea, maybe you have some food cravings, maybe you're fatigued, you might experience some mood changes, maybe you're irritable, you're having anxiety or depression, you might experience increased frequency of urination or in general body aches, typically around the neck area. It really just depends on you. The second phase is the actual headache itself. And this is usually characterized by moderate to severe pain intensity. Usually it presents unilateral, meaning one side of the head. Although I had a patient yesterday that came in with migraine without aura and they had bilateral presentation, so it's not always so clean cut. And then typically patients will describe the pain as a pulsating quality or throbbing quality. And these headaches can last anywhere from 4 to 72 hours, so they can be around for quite a bit of time. Normal amounts of physical or daily activity can actually worsen the headache in this phase when it's occurring. And a lot of my patients also experience nausea and vomiting, dizziness, sometimes vertigo, or light sensitivity, sensitivities to sound and smell. Light sensitivity being about 90% of patients will experience that. The third phase of migraine without aura that occurs is called the postdrome, meaning after the headache. And typically this will last anywhere from hours or days. And a lot of my patients just describe experiencing extreme fatigue, levels of depression, or even the opposite, euphoria. Sometimes they just feel like they're hungover and really out of it. So it's not a good feeling, but the only good thing about the postdrome is that the headache is over. I just want to again reiterate the importance and encourage you, if you are experiencing these symptoms and this headache presentation sounds like you, then schedule an exam with myself, or if you're not in the area, schedule your exam with someone that knows headaches, that is a headache specialist like myself. A proper comprehensive history, physical exam, and neurological evaluation is needed to determine the actual root cause of your headache pain. So take that into consideration. If this sounds like you, take action right now. So you're probably wondering, well, that's great. It sounds like I have migraine without aura. What do I do about it, doc? Honestly, that's somewhat of a loaded question because there's a lot of depth to the answer that I want to provide you. And really the answer depends on you. It's different what I would do with person A and person B because everybody's different, right? So that's a question that's better left for a different video. So with that said, the first step for you in terms of treatment is to watch our migraine and headache video series where we go into details on natural, non-invasive, non-drug solutions to overcoming migraines and headaches. And you can access that video series by clicking the link below in the description right below this actual video. Most facilities that you go to will quickly resort to medications, and usually that's the only option available for you. The problem with medications is that they don't really treat the root cause of your headache pain. Your headache is not occurring because of lack of medication. You're not deficient in that medication. Medications can be likened to putting out the smoke and not the fire. Now I will say, in many instances, And especially in acute situations where these headaches are really, really severe, medication may be necessary just to regulate symptoms. And then in the background, you want to work with someone like myself to dig a little deeper and figure out the root cause of your migraine headaches. So there you have it. We just talked about what are the signs and symptoms of migraine without aura. How can you tell if your headache is migraine without aura? We talked about some solutions, and that would be what? Watching our migraine headache video series. There's a ton of information. There's a wealth of information on there on natural strategies for relieving your migraine headaches. But what next? What should you do next if you want to get rid of migraines? If you want to identify and treat the root cause of your migraines, click below this video in the description and you'll see a free consult link. That's the first thing to do. Schedule a consult with myself and we'll get to the root cause and get you out of pain so you can get back to your life. If you enjoyed this video, be sure to give it a thumbs up and subscribe to our channel. This is Dr. St. Jean from The Chicago Chiropractor. I'll see you next time. Bye-bye.